Have you ever been driven crazy by that constant ringing, buzzing, or whooshing sound in your ears, a noise that no one else seems to hear? What if I told you that this relentless noise, which affects millions worldwide, might be eased by a surprisingly simple trick, one that many doctors don't talk about? Yes, you heard me right. There is a method so straightforward that it's almost shocking, and yet it's something the medical community tends to overlook or even avoid discussing. Why is that? Stay with me, because today I'm going to walk you through everything you need to know about this tinnitus hack that could change your life. First, let's understand what tinnitus really is. Tinnitus is not a disease, but a symptom, a perception of sound without an external source. It can manifest as ringing, hissing, humming, or even more complex noises. Around 15% of people worldwide suffer from tinnitus at some point, with some experiencing it chronically. For many, tinnitus is a mild annoyance, but for others, it becomes a severe, life-altering condition that disrupts sleep, concentration, and emotional well-being. You might wonder, why does tinnitus happen in the first place? The answer isn't simple, and therein lies the challenge. Most often, tinnitus stems from damage or dysfunction in the auditory system, the delicate structures in the ear and the complex neural pathways in the brain responsible for processing sound. Common causes include prolonged exposure to loud noise, age-related hearing loss, ear infections, or even side effects from medications. However, in some cases, tinnitus arises without a clear, identifiable cause, making treatment even more complicated. Given this complexity, conventional medical approaches to tinnitus often focus on managing symptoms rather than curing the underlying cause. Treatments range from sound therapy and hearing aids to cognitive behavioral therapy and certain medications. But here's the catch. None of these methods work universally, and many patients find themselves trapped in a cycle of frustration and disappointment. So, what if there's a different approach? Something simple, accessible, and backed by emerging scientific insights. This is where the hack I mentioned comes into play. Before revealing the hack, let's ask, why do current treatments often fall short? The problem lies in how tinnitus is understood and approached. For decades, medical research viewed tinnitus primarily as a problem of the ear, but more recent studies show that tinnitus is a brain issue, a kind of maladaptive neural activity in the auditory cortex and related areas. The brain, in response to missing or distorted input from the ear, starts to fill in the gaps with phantom sounds. This means that effective tinnitus treatment requires addressing not just the ear but the brain's processing mechanisms. Unfortunately, this neurological perspective has only recently gained traction in clinical practice, and many doctors still rely on outdated models. Now here's the intriguing part. The simple hack involves a specific technique that targets the brain's maladaptive activity directly, helping to retrain neural circuits and reduce the perception of tinnitus. It doesn't require expensive devices or invasive procedures, just consistent practice of a method based on sound therapy combined with cognitive engagement. You might ask, what exactly is this technique? It's called notched sound therapy, or tailored acoustic stimulation. The idea is to play sounds that exclude the tinnitus frequency, hence the notch, stimulating the brain in a way that encourages it to suppress the phantom ringing. Why does this work? Think of your brain like a radio tuner. If one frequency is stuck on static, the tinnitus sound, playing all the other frequencies around it except the static frequency can help the brain recalibrate and reduce the static noise. The absence of the tinnitus frequency in the sound input allows the brain to focus elsewhere, reducing overactivity in the tinnitus frequency's neural circuits. Clinical studies have demonstrated that when patients listen daily to carefully customized notched music or tones over several weeks or months, many report significant reductions in tinnitus, loudness, and annoyance. This is a big deal because it suggests that tinnitus can be modulated by changing auditory input in a targeted neurological way. But here's a question you might have. If this method is so effective, why don't more doctors use it or tell patients about it? There are a few reasons. First, the therapy requires a degree of personalization. Each patient's tinnitus frequency needs to be identified precisely, which requires equipment and expertise not always available. Second, many healthcare providers are cautious or slow to adopt newer methods until larger long-term studies confirm their effectiveness. Third, it challenges the traditional ear-centered treatment mindset, which can be difficult for established practitioners to shift. Nevertheless, the good news is that notched sound therapy and similar brain-focused approaches are becoming more accessible. You don't necessarily need to wait for a specialist. There are apps and software that allow you to identify your tinnitus frequency and generate tailored sounds right from your phone or computer. Now, you might be wondering, can anyone try this? Are there risks? Generally, sound therapy, including notched sound therapy, is safe and non-invasive. The main consideration is patience and consistency. These therapies don't work overnight. You'll need to dedicate daily listening sessions for several weeks to notice meaningful changes. Another important question is, what if the tinnitus frequency changes or fluctuates? This can happen, and the therapy may need to be adjusted accordingly. Some modern apps can retest your tinnitus sound periodically to keep the treatment tuned to your current condition. It's also worth mentioning that this hack works best as part of a comprehensive tinnitus management plan. Stress reduction, good sleep hygiene, avoidance of loud noise, and sometimes counseling can all enhance outcomes. The brain is complex, and tinnitus is multifaceted, so combining approaches gives you the best chance of relief. So, to recap, tinnitus is a brain-related condition where abnormal neural activity creates phantom sounds. Traditional treatments often fall short because they focus too much on the ear. The simple, doctor-disliked hack is to use notched sound therapy, customized sound stimulation that helps the brain suppress the tinnitus signal. It's simple, non-invasive, and increasingly available to patients at home. If you're dealing with tinnitus, I encourage you to explore this method. Start by identifying your tinnitus frequency. There are online tests and apps for that. Then find or create notched sounds that exclude that frequency. Listen regularly, be patient, and track your progress. Of course, always consult with your healthcare provider before beginning any new treatment, especially if you have other ear or neurological conditions. But don't be discouraged by the lack of mainstream attention. Sometimes the simplest solutions are hidden in plain sight. If you want to dive deeper into the science and find recommended resources, I've linked several trustworthy sources in the description below. And if this video has helped you understand tinnitus better or sparked your hope for relief, please consider subscribing to the channel for more trusted health insights. Remember, tinnitus is challenging, but not hopeless. With the right knowledge and approach, you can regain control over your auditory world. Thank you for watching, take care, and I'll see you in the next video.